Thank you for listening to Depictions Media Radio. Okay, we have the director of PAHO, Dr. Carissa Etienne. She is asking the G7 nations to prioritize Latin America and the Caribbean for 1 billion vaccine donations. She's claiming these areas are only 1 in 10 people have actually been vaccinated. The hospitals are full with COVID patients, and the virus is still spreading rapidly in the Latin and Caribbean countries. She is trying to appeal to countries that have surplus vaccines to help donate and slow the virus down and bring the whole world out of the pandemic. So let's listen to what Dr. Etienne actually has to say in her press briefing in this recording.
Hola, muy buenos días y gracias por conectarse a esta sesión informativa de la Organización Panamericana de la Salud sobre la pandemia por COVID-19 en la región de las Américas. Soy Sebastián Oliel del Departamento de Comunicación de la OPS y esta sesión, como todas las semanas, durará alrededor de 1 hora. Ya hemos recibido preguntas suyas por correo electrónico y también podrán hacer preguntas en vivo y a través del chat mediante el botón Q y A. Recuerden siempre, por favor, incluirnos su nombre y el medio de comunicación al enviarnos sus preguntas. También les recuerdo que contamos con interpretación simultánea al inglés, al portugués y al francés y que pueden optar por cualquiera de ellas dando clic en el botón Interpretation. Hoy la directora de la OPS, la doctora
PAHO's director, Dr. Carissa Etienne, will be reporting on the evolution of the pandemic in the region of the Americas, vaccination, and also regarding vaccine acceptance in the region. Carissa Etienne is joined today by Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Health Emergencies Director, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19. I would like to ask now Dr. Etienne to share her opening remarks. Dr. Etienne, you have the floor.
A very good morning to you, and thanks for joining today's press briefing. Last week, there were over 1.1 million new COVID-19 cases and 31,000 new deaths reported in the Americas. And for the last few weeks, 4 of the 5 countries with the highest weekly death counts in the world continue to be here in our own region. Mexico has reported a slight uptick in cases, driven mostly by both the Baja California region, the Yucatan region over the past 2 weeks, while COVID-19 cases and hospitalizations are slowing in the US and Canada. Cuba and the Dominican Republic continue to drive most new cases in the Caribbean, while Trinidad and Tobago is still reporting high death rates. In Central America, infections over the past 2 weeks are on the rise in parts of Belize, while case incidence in Guatemala and Panama has risen over the past week. Costa Rica and Honduras are starting to see a decline in cases. Further south, recent surges in COVID infections are filling hospitals in Bolivia, Chile, and Uruguay, mostly with younger patients between 25 and 40 years of age. In the Brazilian city of Sao Paulo, 80% of the ICU beds are occupied by COVID patients. And Colombia's COVID situation is now at its highest point nationally, with very high occupancy of ICU beds in large metropolitan cities. Against this backdrop, we urge countries to tighten public health measures in places with high transmission. This is the most effective way to bring cases down until we have enough vaccines for everyone. Over the weekend, leaders from the Group of Seven pledged 1 billion COVID vaccine doses for countries in need around the world. This promise brings fresh confidence that we will overcome the supply barriers that have prevented many nations and territories in our region from getting the doses that they need to protect their populations. Today, less than 1 in 10 people in Latin America and the Caribbean have been fully vaccinated against COVID. Yet, we are a region of more than 600 million people where cases are mounting, hospitals are full, and variants are rapidly circulating. So, while vaccines are needed everywhere, we hope that the G7 will prioritize doses for countries at greatest risk, especially those in Latin America that haven't yet had access to enough vaccines to even protect the most vulnerable. These doses cannot come soon enough, so we urge G7 countries not to delay their donations. We need the vaccines now. Across the Americas, while COVID vaccines have been slow to arrive, uptake has not. Just this past weekend, over 140,000 people were vaccinated in the Brazilian city of Manaus. And throughout Latin America and the Caribbean, people are eager for a chance to get vaccinated. So it's easy to see why. Because vaccines work. More than 2 billion COVID doses have been administered around the world. In places where COVID vaccination coverage has been high, like some United States, the United Kingdom, and Israel, there has been a dramatic reduction in COVID-related hospitalizations and deaths. When outbreaks occur, as Chile is experiencing now, COVID vaccines are protecting those who are vaccinated, including health workers, from the worst of the virus. And this is exactly what COVID vaccines were designed to do, to protect our communities and to help us save lives. With the prospect of additional doses, we want to remind countries about the importance of communication campaigns to maintain trust in vaccines. Having clear and transparent information about when doses are or aren't available and consistent guidance on who is eligible for vaccination is key to increasing confidence in our vaccination programs. It is when there are breakdowns in information and communication, or when details are slow to arrive, that misinformation can take root. The World Health Organization and PAHO have issued updated guidelines for countries making and adjusting their COVID vaccination campaigns as additional doses are made available. When these new doses arrive, we also want to remind countries that prioritizing vaccines for those most vulnerable, like the elderly, our frontline workers, and those living with pre-existing conditions, that this is key to protecting hospitals and saving more lives. Health workers should receive special attention as they're not just at greater risk of contracting the virus, but they are also some of the most trusted voices for vaccines. People naturally turn to health workers, including doctors, nurses, and community health workers for medical advice. So we must ensure that our health workers have the information that they need to answer their communities and their own families' questions. And finally, I want to remind citizens that the vaccines authorized by WHO and delivered through COVAX have been thoroughly assessed by experts. So when it is your turn to get vaccinated, embrace what's available to you and don't delay your vaccination. Getting vaccinated as soon as you're eligible is the best way to protect yourself and your community. This also means that if your vaccine requires 2 doses, you should get your second dose when it is scheduled to ensure that you have the best possible protection. I want to be clear that the primary issue in the Americas is vaccine access and not vaccine acceptance. Across Latin America and the Caribbean, we have a long legacy in immunization and trust in the life-saving power of vaccines. Once new doses are available, countries are ready to distribute them as quickly as they arrive. And PAHO will work tirelessly to get vaccines to every corner in our region until this pandemic is behind us. We are counting on our leaders and the support of the global community to ensure that the Americas have the doses that they need as soon as possible to save lives.
Muchas gracias, doctora.
Thank you very much, Dr. Etienne. Now we are going to answer the questions that we have received via email and that we continue to receive through the Q&A button. Please remember to include your name and media outlet. And the first question that we have received is from Ernesto Londoño.
In Brazil, healthcare workers have expressed concern over the number of people who appear to be skipping their second dose appointment. Is this a phenomenon PAHO is watching? Does it appear to be widespread in the region among populations that are eligible for vaccines? Dr. Etienne?
So, thank you, Ernesto of the New York Times, for your question. So we have had reports that this is happening in some countries, and while the data is still limited, we really don't think that it is a widespread phenomenon. But even so, this should not happen. We need to use all means possible to ensure that people are fully vaccinated when their turn comes. There is strong data showing that vaccines with 2-dose regimens, like the ones that are in use in our region, offer their best protection when both doses are delivered within schedule. People that have completed their vaccination cycles are significantly better protected from severe COVID and also the risk of death. This is true even with the new variants that are circulating. Each one of us should really take the responsibility for protecting ourselves and for making sure that we show up for our second dose appointment. This is not just a matter of personal commitment. It is also a matter of public health. We know that vaccines work best when many of us are fully immunized. This helps prevent illness and death and eventually the spread of disease. So that's why it's really crucially important for immunization programs throughout our region to set up the systems that are required for helping people get their second dose as planned. And in this, healthcare workers at the primary healthcare level have an important key role to play in following up with community members through whatever means possible. When people or where people don't come for their vaccines, the health systems must go to the people with classic community outreach, offering immunization where they are, whether they are in remote villages or in urban slums. This is the primary healthcare way of reaching those that are not yet reached. With so much inequity we need to make sure and we need to ensure that most of the vaccines that we have at hand are used. We need to make the most of them. Stopping the pandemic for good will require that we not only have access to the vaccine, but we administer them widely, covering 70, 80, 75% of our population. Thank you.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. The next question is by David Zapata from La Prensa in Honduras, and he says, what is PAHO's opinion regarding the progress made with vaccination against COVID-19 in Latin America, in particular in Honduras, which he says is one of the countries in the Central American region that has applied the least amount of vaccines? Dr. Barbosa, thank you, David, for the question. Our director has underscored throughout our press briefings that we consider that Latin America needs to have many more vaccines than they have access to right now. This is a reality in Latin America and the Caribbean. They continue to be the epicenters with high mortality rates in several countries. Access is very limited still for many reasons that are familiar to all of us, and also the fact that some countries are accumulating many of these doses. So they do need more vaccines. We do need more vaccines for the region to protect the most vulnerable population and also to attain vaccine coverage to control transmission. There are some countries in Latin America that have used several alternatives, such as the vaccine through the COVAX facility, bilateral agreements, among others, are advanced, such as Chile and Uruguay. But in most countries in our region, vaccination continues to go slower than what is needed. We continue to underscore this topic because the region does need more vaccines. In the case of Honduras, Honduras has received through COVAX 238,000 doses in addition to other doses that will be available in the upcoming weeks. So those doses are sufficient to protect healthcare workers, but they are not enough to protect all of the vulnerable groups. That's the reason why we need to understand that we need to look for new alternatives, donations by the countries such as the US, and Spain has already done, or they have committed to doing, and also the G7 countries have pledged to doing, so that we can have more equitable access to the vaccines in the world, in particular in the region of Latin America and the Caribbean. Thank you very much. Thank you, Doctor. Now, I would like to give the floor to Melina Ochoa from UNO TV Noticias in Mexico City. Melina, please go ahead. Good morning. Can you hear me? Yes. Good morning. My name is Melina Ochoa, journalist with UNO TV in Mexico City. I would like to know what PAHO thinks about this uptick that Mexico is going through in 6 federal entities: Baja California Sur, Campeche, Sinaloa, Veracruz, Tamaulipas, Quintana Roo, and Yucatan. They have been announced by the Assistant Secretary, Mr. Lapel, and whether it is necessary to relaunch actions or a new program to avoid an increase in the number of cases and deaths in the Mexican country, since people have too much information and they are not paying too much attention to the pandemic. Dr. Aldigueri, could you please address this question? Yes, thank you, Melina. I had shared some thoughts about the evolution in Mexico last week during our press briefing, but it will be a pleasure to offer you an update. Mexico is reporting regularly on a daily basis under the international health regulations, and they are also publishing updated information and the traffic lights that allow them to have a clear idea of the trend in the 32 federal entities. So even though the trend continues to be in a plateau in most states, as you mentioned, those 6 states have reported an uptick. Out of those 6 states, 4 of them are orange based on the traffic lights: Baja California del Sur, Tabasco, Quintana, and Yucatan. Clearly, the situation in those states, such as the Yucatan Peninsula or the Baja California Isthmus, that are touristic areas, need to be accurately assessed given national and international conditions within this context. We have been informed by the federal health authorities of close contact with the states mentioned before to reactivate preventive measures and also to enforce vaccination. But a new program within this context would not be appropriate. We recommend to apply the current plan, underscoring the following aspects: the promotion and strict application of pharmacological prevention measures, the public health measures, and the acceleration of the pace of vaccination to cover the most number of individuals, strengthening of variant surveillance, the variants that are circulating for SARS-CoV-2, and also a characterization of these outbreaks with the tools available in Mexico, including virus sequencing, as well as using the outbreak research tool, CoData, which is a tool developed by WHO, which has been adapted and adopted by federal authorities starting last year. So once again, the idea is to implement strengthened version of the current plan, underscoring those 4 aspects, and I hope I have addressed your question. Thank you. Thank you, Doctor. We have questions related to the beginning of the winter season in the south and also the hurricane season in the Caribbean. And the question is, how should the countries prepare and how can outbreaks or surges in the number of cases be avoided in these 2 different contexts? Dr. Ugarte, thank you, Sebastian. This is a high priority issue for hurricane-prone countries and also for those countries that have very severe winters. PAHO rather has met with international regional bodies and experts as to how to face a hurricane season, but also winter within the context of COVID-19. We have witnessed the devastation as a result of hurricanes, in particular last year in Central America, where about 10 million individuals were directly impacted by the hurricanes and where there was damage to health services, and there was also an impact in the increase in the number of COVID cases. Many individuals had to resort to temporal shelters where conditions favored the transmission of the virus. In this case, it is very important to guarantee that health services continue to be operational at all times. In particular, when we're talking about health services, we are referring to health centers, hospitals, but also diagnostics centers and laboratories and other services that are provided through the public health service, so that we have hospitalization beds as well as ICU beds, and that those centers where in which people need to quarantine are functional, and we also need to make sure that individuals have access to health services, that is, that health professionals are available and ready to, in case of emergency, to travel to those areas that are the most affected. And I would like to underscore something that is highly important in the context of winter season and the hurricane season. It has been proven that the measures implemented from the outset of the pandemic, from the beginning, continue to be valid. And in the context of extreme events, this is continues to be the case. That is to say, identification of clinical cases, suspected cases, and also the isolation of suspected cases, as well as quarantine for those contacts and the timely treatment of those cases. This will allow us to continue to control the epidemic as we await for vaccination to reach protection levels for the population. Winter also allows for individuals to be in closed space indoors much more often, and transmission is higher, so we need to strengthen mechanisms at all levels. Thank you. Thank you very much, Dr. Ugarte. Now we are going to move on to the next question by Emilia Dexler from Clarín, Argentina. There are several questions. What is PAHO's position in connection with the use of AstraZeneca in individuals younger than 45, and whether PAHO confirms that AstraZeneca has to be applied to everyone regardless of age and gender, and should like to know whether there has been any changes in the criteria implemented by PAHO for vaccines through COVAX to be distributed based on epidemiological risk. Dr. Barbosa, thank you. Thank you for those questions. Emilia, at PAHO, we follow the recommendations provided by WHO vaccination expert group, that is SAGE, and also our own Gavi, that is our own technical advisor on vaccines. Those are the two groups that have individuals from all over the world, individuals that have experience, wide experience and knowledge on the use and safety of vaccines, their efficacy, and that is the group that recommends the use of vaccines. So far, SAGE with WHO continues to maintain the same recommendation regarding AstraZeneca. That is, they are vaccines that can be used for individuals older than 18. There are also very important pieces of information regarding the effectiveness, the efficacy of the AstraZeneca vaccine, and the information was communicated by the UK Information Agency that shows the high efficacy of this vaccine to protect against severe COVID cases and to protect also against deaths and hospitalization. So the countries need to make their own decisions, but based on the analysis carried out by SAGE and also based on the evidence so far, we continue to recommend the use of the vaccine for people older than 18. The exception would be for pregnant women. There is no authorization to use the vaccines in pregnant women, and an assessment, a risk assessment has to be conducted. If it is a pregnant woman who works in an ICU or that is in contact with COVID-19 patients at all time, there is a high risk, and then there should be an assessment to determine whether the vaccine has to be administered or not. As to the debate, the discussion, this is an open discussion, and it is important to participate in that debate. And there will be a meeting in July. There will be a meeting with the Council in July, and we think that it would be important to have some criteria as to how the epidemiological situation is so that all of the countries may receive the proportion that they have agreed to receive through COVAX up to late 2022. That is to say, the ones that requested 10%, 20% will be receiving all of the vaccines requested, but the line for delivery could be affected by some sort of criteria so that the countries that have the highest risk could receive the vaccine first. This is an important debate, and it is important to reach consensus among the countries, among the Gavi, so that we can have proper coordination with all of the countries, and we can implement criteria to perfect the vaccine delivery mechanism.
Thank you very much, Doctor. And the next question is from Jim's questions, and it's
varias preguntas. Dice, how is PAHO assisting Haiti in his country's effort to save a surge of the number of new infection of cases? Haiti is expecting to receive soon a shipment of vaccines. Is PAHO part of that international sharing operation? If yes, will that type of assistance continue in the future? And also, is the PAHO office in Port-au-Prince participating in an awareness campaign to motivate the population about the danger posed by COVID-19 and encourage them to get vaccinated? Doctora Aldigueri, quizás pueda comenzar, y el doctor Barbosa si quiere complementar estas preguntas.
Yes, thank you, Sebastian. I will start, maybe cover the first point and part of the third point. So PAHO is assisting the national authorities of Haiti for all pillars of the response plan to COVID-19. And as for previous emergencies, we have pre-positioned assets in the national warehouse promise. PAHO has a strong team working in Haiti, providing direct technical assistance to the Ministry of Health, MSPP, but is also working with other national partners as the Centre Gestion, Amis de la Santé, and others, and closely coordinating with international partners as the US CDC and also through the Global Outbreak Alert and Response Network called the GO. So on these pillars of the response, I'd like to highlight a couple of them, and of course this will be complemented by my colleagues after. First, I'd like to highlight the surveillance systems, including our direct assistance to the Public Health National Laboratory, including for the genomic surveillance. Batches of samples have been processed in PAHO regional reference laboratories and have identified, for example, the P1 variant in circulating in Haiti, but also working on the expansion of the surveillance in the 10 departments, including with antigen-based rapid tests. But also the second aspect that I'd like to flag is the training and for clinical management of patients and also for infection prevention and control, including with the deployment of personal protection equipment, again, through the national warehouse. The third point that I'd like to flag is the surge capacity for managing more severe patients. And in this context, we have a couple of emergency medical teams in standby in countries of the region if their assistance is required by the national authorities, depending on the evolution of the situation. And just as an introduction to this bigger topic, of course, PAHO is working closely with the authorities on the preparation for the vaccination. This is part of our core activities in Haiti, including the communication for with the public for promoting the vaccination. And on this point, I understand that my colleagues would complement on this. Thank you, Sebastian.
Thank you. Thank you for this question. We are very concerned about the Haiti and trying to support Haiti in many different areas to get the immunization against COVID-19 starting in Haiti. Haiti is the only country in the Americas that is a member of COVAX that hasn't started the vaccination yet, due to many several problems, the complex situation in the country. From the beginning, we are supporting the country to prepare all the administrative measures that they need to receive the vaccines. Haiti is one of the 10 AMC supported countries that we have in Latin America and the Caribbean. So Haiti will receive vaccines free of charge, but they need to adopt the legal, regulatory, and administrative measures. Everything now is ready. The government of Haiti is set to receive the vaccine. So I work with the COVAX Secretariat to Haiti as a priority for a new deployment. We will start in July, and we will have the date in a couple of weeks to share with the government of Haiti. But we are also working in other areas, in other fronts, to get the vaccines arriving in Haiti. We are working with the U.S. government that also has Haiti as one of the priority countries to receive the vaccine. We are working on a daily basis with the government of the U.S. To respond all the challenges, the logistics, the administrative measures, legal measures, in order to get the vaccines there as soon as possible. This is very important because, as Sylvain Audiguieri mentioned, the cases in Haiti are increasing, so we probably will face a very important and challenging situation in Haiti, and it's crucial that they adopt the public health measures and at the same time that they get the vaccine to protect the most vulnerable groups in the country. Thank you.
Gracias a ambos. Tenemos algunas preguntas sobre Venezuela.
Thank you very much to both of you. We have some questions about Venezuela. Nicole Chapur says, what is the time frame for Venezuela making the payment to Venezuela? So can COVAX send vaccines to Venezuela without the payment having been completed? And another question about the variants in Venezuela, and if we could give an update on the C37 variant in that country. Dr. Ugarte, please. Thank you very much. First, I will refer to the general questions, and then I'll ask Dr. Barbosa to complement the answer. As we know, there is a modality of payment that the countries that have chosen what type of vaccine to receive must make a payment. This payment has been processed in most instances, and there is an amount that needs to be paid to complete full payment. All efforts are being made for the payment to be completed, and we hope this will happen as soon as possible. And this will determine how many doses can Venezuela receive, and also it will determine the type of vaccine, etc. Regarding the variants, let me emphasize that Venezuela has received support from PAHO, both from the regional level and from the country office level, to have the ability to detect the variants. This work to detect variants has been done with the National Hygiene Institute and with the Institute of Scientific Research. And the Ministry of Health of Venezuela has shared information with us regarding the results of this surveillance effort, and they have been having regular technical cooperation ties with both the regional and national levels of PAHO. The information available right now indicates that the Gamma variant is the most predominant throughout the country, and the Alpha variant has been detected. Apure and Barina, these both are variants of concern. The system can detect other variants, which are also variants of interest, and this indicates the ability for detecting these variants with the support of regional have been detected in Zulia, Trujillo, and Barinas. And this surveillance is very important, both to detect the level of transmission of the disease and the likelihood of increased transmissibility, but also to be able to control the dissemination, the spread, and the measures that should be taken to control the pandemic. Thank you. Thank you. Yes, let me supplement briefly here. Venezuela at the beginning was not very clear at first whether Venezuela was going to join COVAX or not, but fortunately the country made the decision to continue on with COVAX, and they have made the payments that all countries need to make, and they have been making these payments. The countries that are high financing countries such as Venezuela need to make payments, and Venezuela has requested to change the contract they have. There are two options for the high financing countries. Venezuela at the beginning had made a decision to take one pathway, but then they requested to change. And we supported the country in their negotiations with COVAX Secretariat so that they can go through with the switch of the option of purchasing through the COVAX facility. This is being completed right now. Since it's a high financing country, they have to pay for their vaccines that they will receive. So we hope that within a couple of weeks we will be able to conclude all the financial aspects, and so Venezuela can be included in the next rounds of vaccines that will be distributed through the COVAX facility. So what is outstanding is the change in contract and the finalizing payments, and we hope that this will happen promptly. Thank you. Thank you to both. Next question has to do with G7, and in English it is
statement about the commitment to donate millions of vaccines. Dr. Etienne?
So let me thank you for this question. Of course, we welcome the announcement by the group of 7 who pledged 1 billion COVID vaccine doses for countries around the world. So these donations and the agreements to purchase additional doses for countries in need offers what I think is fresh hope for countries that are struggling to secure enough vaccines to protect their populations, and for the people around the world who are eagerly awaiting protection. But let us be clear that this is also in the best interest of the developed countries themselves, those who have already achieved high vaccination coverage. Today, less than 1 in 10 people in Latin America and the Caribbean have been fully vaccinated against COVID. And what we are saying is that cases are peaking, hospitals are full, and we are already home to the 4 of the 5 highest death rates in the world. So the Americas, we have been in crisis for months, and without the international community's support, recovery remains a distant future. So while vaccines are needed everywhere, we do hope that the G7 nations will prioritize doses for countries at greatest risk, including countries right here in our region. Equitable access to vaccines requires that we prioritize not just the individuals at greatest risk, but also the countries at greatest risk. And certainly I think that this is both the right thing to do, and it is the best strategy to prevent needless death and to stop the spread of this virus faster. So this is why we hope that the epidemiology informs which countries are first to receive these donated doses and future COVAX deliveries. I also want to emphasize that timing is key. Vaccines are urgently needed today, so we urge G7 countries not to delay their donations. As we've said before, the Americas are ready to distribute doses as quickly as they arrive. And PAHO stands ready to support our countries. Those countries that are suffering the most should be at the front of the line. And finally, let me be very clear that even with this generous donation, we are still a long way from protecting the more than 600 million people living in Latin America and the Caribbean. Reaching everyone in our region with life-saving COVID vaccines will require the full strength of our collective resources. We need more donations to fill critical gaps in access, and we need them now. We need financial support to secure additional supplies, and we need to increase our region's ability to manufacture vaccines. And we are counting on the support of countries, of donors, and the international community to get us there as quickly as possible.
Thank you, Dr. Etienne. Siguiente pregunta.
The next question is from Julia Simes-Co from Reuters in Colombia. In English, she asks,
shipments of the J&J Janssen vaccine through the COVAX facility, how many doses they should anticipate, and when those doses will arrive. Also, are any doses of the CanSino single-dose vaccine expected to arrive to the region via COVAX? If so, to which countries, how many doses and when? Y agrego también una pregunta de Manuel Lino González de Los Intangibles en México.
there is a question from Los Intangibles in Mexico about the CanSino vaccine. So what is the status of the CanSino vaccine according to the WHO's evaluation, Dr. Barbosa?
Julia and the other colleague for the questions. Let me start with the second one about CanSino vaccine. We have two different processes. A vaccine can be authorized by a national regulatory authority. This is a sovereign decision for each country. The national health regulatory authorities, they assess the dossier that the producers present, showing that they meet all the criteria related to good manufacturing practices, so they have a very good quality process to produce the vaccines, and also the data from the clinical trials, phase 1, 2, and 3, confirming that the vaccine is safe and efficacious. So this is a process that every country makes, it's their decision. The fund, that is a true procurement mechanism that purchases vaccines on behalf of COVAX. We use the emergency use listing EUL from WHO as the threshold to make the decision what vaccines can be included in the portfolio. Vaccine presenting data to be reviewed by this group from WHO. WHO, to make this assessment, it's not only the WHO staff, but the WHO established technical groups that have participants from the FDA, from the EMA, from other public health authorities in the world. They make an assessment and they make a recommendation. So CanSino is still in the process. We don't know yet when this process will be finalized. It's similar to other vaccines like Sputnik and others. Of course, that we want to have more vaccines in the portfolio, but all the vaccines need to meet the same criteria. They need to be reviewed by the same thorough process that WHO is performing. About the thing, a good news that Janssen and Pfizer will start providing vaccine through COVAX. Pfizer has already started with a small amount, but from July on, we will have more vaccines from Janssen and COVAX. Janssen is a very important vaccine to be used in some countries, in some places, because it's a one-dose vaccine. So you don't need one dose to be protected. We are still in negotiation with the Janssen to establish the the quantities, the amounts of the volume of doses that producer will provide through COVAX. Expect to have a small amount of vaccines for the months of July, August, but this will increase for the last part of the third quarter, and in the final quarter of this year, we'll have more vaccines. When we finalize these agreements, we will send to the countries the information about the doses that they are available from AstraZeneca, from Pfizer, from Janssen, and we started the negotiation to establish the date in the flight to send these vaccines to the country. So at this moment, we cannot disclose the countries who will receive Janssen because we are still finalizing these agreements with the producer.
Gracias, doctor.
Thank you, Doctor. And now from Luke Taylor from the British Medical Journal and from Director Kerris from the New York Times. Luke Taylor says in English.
Several South American countries, including Colombia and Argentina, are reporting record COVID-19 deaths. What should these countries be doing to bring down those numbers? Why are they experiencing these surges now while the pandemic is receding in much of the rest of the world? And what does the situation in South America, where the pandemic appears out of control, mean for the pandemic in the rest of the world? Y similar, Julie Turkewitz, the New York Times preguntan, what are the reasons that you believe that the virus is so bad in South America and not as bad farther north? Is this just because of the Brazil variant, or are there other factors at play? Dr. Aldiguieri?
Thank you, Sebastian. These many questions would allow me to stress some fundamentals of the response to COVID-19 and also to detail the mosaic, the different patterns of transmission that we are observing in the Americas. First, regarding South America, we are talking about countries with large populations that would explain large absolute numbers of new cases and large absolute numbers of deaths. It applies to many countries of South America, not only Colombia and Argentina. The second point, we are talking of countries with large metropolitan areas, I would say megapolis, that trigger closer contacts between citizens during essential and necessary commuting, even when lockdowns are established by the national authorities. And the third point regarding South America is that we can say that during the last year, the virus has established itself in the most remote areas of their territories and can be quickly and strongly amplified in these remote areas and subsequently spread again to areas where control activities were effective at one point but not maintained. Now, regarding Mexico and Central America, I'd like to remind and recall, as I did, I think one of the first questions in this press conference, Mexico went through an important peak of transmission during the first quarter of 2021. At the moment, the national authorities are closely monitoring peaks in six, mostly in the Baja California region and the Yucatan Peninsula. In Central America, we have observed during the last month increasing trends in Costa Rica, and during the last weeks concerning upsurge in Guatemala and Panama. Therefore, we are closely monitoring the situation in this sub-region. It's unclear how the evolution would be. But for both Central America, South America, the Caribbean, and I would say other regions of the world, there are core aspects of the response to bring down the numbers. First, the capacity of the surveillance systems to detect early an upsurge of transmission, including with genomic characterization. Second, triggered by the early detection of an upsurge, the capacity of the national and local governments to implement rapidly strict public health measures and to maintain it according to the trends. And finally, the capacity of the health systems to manage an elevated number of severe patients, ensuring a high standard of care for reducing the mortality. So I'd like to flag that at this moment of the pandemic response, no country and definitely no region of the world is protected from new peaks of transmission. The recent example of India is a reminder of that. And the actual upsurge of cases in the UK is another example. No country in the region will be safe until a high vaccination coverage is reached in order to have an impact on the dynamics of the SARS-CoV-2 transmission, and that countries find a right balance between strict implementation of public health measures for lowering down the transmission and economic activities. I hope I have answered the concerns of both journalists and this long list of questions. Thank you.
Gracias.
Thank you, Doctor. Now we have several questions related to Nicaragua from Kaylin Romero from El Confidencial and Lidia Lopez from La Prensa. They wanted to know whether PAHO has information whether Nicaragua has already started tests to detect the presence of variants in their country, and if so, what results have been obtained. And Nicaragua is within the list of countries that will receive a Pfizer vaccine donated by the United States through COVAX. But Nicaragua does not have the cold chain to store these vaccines. So what alternatives are open for this country to do that? Or and can they receive the Moderna vaccine, which is compatible with the cold chain that they have in the country? Dr. Ugarte. Yes, thank you very much. PAHO has provided supplies and tools for the variants of countries, including for many countries, including Nicaragua. We have told that the country is finalizing now the method and the procedures to select the samples, and shortly they will have implemented a method of surveillance to detect the variants of concern. We hope that Nicaragua will be able to send the samples to one of the 7 reference labs which are part of the genomic surveillance network that PAHO facilitates. This is one of the steps, and it's built with the solidarity of many countries, and it has been able to detect variants in more than 40 countries and territories in the Americas. Thank you.
Thank you, Doctor. I don't know whether Dr. Barbosa would like to add something very quickly. Lydia, we're working with the government of the United States. The government of the United States is carrying out a very strong campaign to look at the vaccines that can be donated by the U.S. Those are Janssen, Pfizer, or Moderna vaccines, and we are looking at what the best options are for the country, whether the vaccines that are going to be sent need a cold chain that is not available in the country. So that is going to be planned to be able to use the vaccines in the best possible fashion, because we cannot allow vaccines that are not available in the proper quantities to go unused. So we are analyzing the situation in each country to be able to send the vaccines. Thank you. Thank you very much, Doctor. The next question is from Trinidad and Tobago. Just a second. From Gabriel Alvarado from Newsday in Trinidad and Tobago. He's saying that Trinidad is one of the most affected countries in the region. The vaccination rate is low. The country is in lockdown and in an emergency situation that is affecting all of the population. And what is PAHO's recommendation? Dr. Aldigueri.
As it's a question from Trinidad and Tobago, I will answer in English. So the public health authorities in Trinidad and Tobago are reporting with a lot of discipline new cases and death to PAHO under the international health regulations. And so we are aware of the assessment of the government of Trinidad and Tobago. As of June 14, the country has reported almost 29,000 cases and 677 deaths. During the COVID-19 pandemic, several large cities and countries have used lockdown measures, public health measures, as it is being used in Trinidad and Tobago currently, in order to decrease the intensity of transmission by limiting the movement of the population. PAHO is aware that these public health measures have an impact on the economy of the countries. However, when strictly implemented and monitored, they are very effective in bending the epidemiological curve and protecting the healthcare facilities for severe and critical patients. While at the moment the acquisition of sufficient vaccine poses a challenge, the country, Trinidad, should continue to vaccinate as many persons as possible. It is important to note that with limited movement for a specified time period, coupled with its continued effort to provide vaccine for its population, Trinidad and Tobago can decrease the level of community transmission with an eventual return to economic activity. I hope I have answered the question from Trinidad and Tobago. Thank you.
Muchas gracias, doctor. Siguiente pregunta.
Thank you very much, Doc. The next question is from the Miami Herald, and in English it reads:
5% of responders refused getting a vaccine against COVID if it was within reach, compared to only 9% who would agree to take it without constraint. And she says that understand that PAHO recently conducted its only survey, and is this consistent with your findings, and how do you battle these kinds of hurdles, given that at this stage the government still hasn't started any vaccination campaign, distribution is still unclear, and a lot of PR damage has been done to the principal vaccine that Haiti is supposed to receive? Dr. Barbosa?
Thank you for this question. This is a very important topic, and from the beginning, PAHO is providing technical cooperation to our member states, because to have a good immunization campaign, you need the vaccine for sure. Without vaccine, you can do nothing. But you also need many other activities around the vaccination. And a good communication strategy is one of them, and probably the most crucial one that we have nowadays. Because unfortunately, the vaccine was targeted for many anti-vax groups, people that are sharing rumors, conspiracy theories around the COVID-19 vaccine. So as our director mentioned at the beginning, this is not the main problem that you are facing. Of course, that the countries in our region, they have long-standing tradition to vaccinate millions of people, but it's very important that the national authorities in each country establish a direct and transparent channel of communication with healthcare workers, with the communities, with the population, showing them the data. It's not a hypothesis. We have data, and now data from real life, showing that vaccines can save lives and can contribute to control this pandemic and to allow countries to recover from the very important impact that their economies are suffering. So we are supporting the means of health to do that. And of course, that is through our country office in Haiti, and also from our team here in Washington. We are working with the Haiti Ministry of Health to have a very good communication to show the facts, the evidence to the population and to healthcare workers, to allow and to support and to encourage people to get the vaccines that will save their life. Thank you.
Gracias, doctor. Ya estamos llegando al final de la
Thank you very
sesión.
much, Doctor. We're reaching the end of today's press briefing, and the next question is Tobias Kafkan, who is working for Latin America in English.
That have made successful progress in immunization still see high numbers of new infections. Dr. Etienne?
So thanks again for this important question. As we've made the point before, vaccine coverage differs from country to country. So while there are some countries in our region that have yet to protect even 1% of their populations, some countries like the US, Chile, and Uruguay, they have been able to secure and administer vaccines faster than most countries in our region. And what we've learned from reports that in places where COVID vaccination coverage has been high, like in the US, the United Kingdom, and Israel, there has been a dramatic reduction in COVID-related hospitalizations and deaths. And when outbreaks do occur, as we've seen in Chile, COVID vaccines are protecting people from the worst of the virus. If you will recall, in my remarks, I did say that the highest groups that we are seeing hospitalizations, it's the 20 to the 40-year-old age group. And you will recall that that was not the high priority in all of our countries when we went through the prioritization for vaccination. And this protection is exactly what COVID vaccines were designed to do, to protect our communities and help us save lives. So it is protecting those priority groups that it was first given to. So one of the things that we need to be clear about is that vaccines cannot stop an active outbreak. And COVID outbreaks can still happen even with high vaccine coverages. No country has yet to reach herd immunity. And so more remains to be seen about how we can achieve population-wide protections, particularly as the variants circulate. Let's just remember that vaccines are just one tool in our COVID arsenal. And that is why we've always emphasized the importance of relying on proven public health measures, even as vaccines are rolled out and until we are able to arrive at sufficient coverage for herd immunity. Countries will still need to support testing and contact tracing, isolation, quarantine to limit outbreaks. And people should still have the tools and the support that they need to protect themselves and the sick and to prevent others from getting infected. And of course, people need to follow the regular measures of wearing masks, on social distancing, and frequent hand washing, etc. And as I said before, ending this pandemic will require leveraging all the tools that we have at our disposal. So let me thank you again for joining this press briefing, and let me wish all of us a safe week. Thank you very much.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos llegado al final de la sesión de
Thank you
hoy.
very much, Dr. Etienne. We have reached the end of this press briefing. As usual, you can find further information on PAHO's website, including daily updates with the situation numbers and also the epidemiological situation, www.paho.org.coronavirus. And you can also find further information on our webpage in general. So thank you again. Take care and greetings.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.